Lemon juice is a refreshing and healthy ingredient that many people incorporate into their daily diets without considering the potential risks. However, did you know that improper use of lemon juice can pose serious health threats? In this video, we'll discuss 10 critical mistakes involving lemon juice that could jeopardize your well-being. These errors may lead to severe health issues, such as stomach ulcers, heart attacks, liver problems, kidney issues, and even cancer. From unsafe combinations with other foods to risky applications in cosmetics, you'll be shocked by the hidden dangers lurking in lemon juice. Be sure to watch until the end to protect yourself from these perilous pitfalls. This video promises to be extremely informative and beneficial, so if you want to master your health, hit that like button, and let's dive in. Before we start, a big request from you is to like this video, subscribe to our channel, and write a kind comment. Let's get started, friends. Number 10. Mixing lemon juice with nitrate-rich foods. At first glance, pairing lemon juice with nitrate-containing foods might seem harmless and even advantageous. People often add lemon juice to salads featuring vegetables like beets, lettuce, or spinach, which are high in nitrates. However, this can be a grave mistake, increasing cancer risk. When consumed together, the citric acid in lemon juice can react with nitrates during digestion, leading to the formation of nitrosamines, carcinogenic compounds known to elevate cancer risk. Research from the American Cancer Society shows that nitrosamines are linked to stomach, esophageal, and colon cancers. These compounds can damage DNA, resulting in cell mutations and unchecked growth, which are key mechanisms in tumor formation. Although small amounts of nitrates are generally considered safe and may even enhance blood flow, combining them with citric acid can produce harmful nitrosamines. Regular consumption of foods containing nitrates, especially those grown with nitrogen fertilizers, can pose a serious risk. In 2019, a case in Germany highlighted this danger. Katharina Mueller, a 47-year-old woman, frequently prepared salads with beets and spinach, dressing them with lemon juice, believing it was a healthful choice. Years later, she was diagnosed with stomach cancer, attributed to her consistent exposure to nitrosamines. To avoid this dangerous mistake, it's best to pair lemon juice with foods low in nitrates, like cucumbers or tomatoes. Always check the origin of produce and choose organic options to minimize chemical fertilizers. If you do enjoy lemon juice with nitrate-rich vegetables, limit how often you consume these combinations to reduce nitrosamine formation in your body, thus protecting yourself from serious health issues, including cancer. Number 9. Using lemon juice as a toothbrush. At first glance, brushing your teeth with lemon juice might seem like a natural and beneficial method. Many believe that the high acidity of lemon can whiten teeth and eliminate plaque. However, this is a dangerous misconception that can lead to severe oral health issues. In reality, lemon juice erodes tooth enamel, making teeth susceptible to infections and decay, potentially leading to tooth loss. Tooth enamel, the hardest tissue in the human body, serves as a protective layer for teeth against acids, bacteria, and physical stress. Once damaged, it cannot regenerate. According to the National Institutes of Health, exposure to citric acid can gradually erode enamel, increasing sensitivity, pain, and accelerating decay. With a pH of around 2.5, lemon juice is highly corrosive and quickly depletes the protective enamel layer, leaving teeth vulnerable to decay and infection. The CDC reports that 1 in 3 adults experiences the consequences of tooth enamel erosion, particularly those using acidic dental products. As erosion progresses, teeth can weaken to the point of breaking, and infections can spread to surrounding tissues. Mark Wilson, a 34-year-old from London, used lemon juice to whiten his teeth, believing it was a safe practice. After a few years, he experienced heightened sensitivity and discomfort. A dentist's visit revealed severe enamel erosion, leading to decay and the need for several tooth extractions. To avoid enamel decay and serious complications from lemon juice, you should stop using acidic products on your teeth. Instead, opt for dentist-recommended oral hygiene products like fluoride toothpaste and professional whitening solutions when necessary. The FDA strongly advises against prolonged contact between acidic products like lemon juice and your teeth, as it can cause permanent damage. If you enjoy the flavor of lemon, consider adding it to water, but be sure to rinse your mouth with clean water afterward to eliminate acid residue and prevent enamel breakdown. By steering clear of these harmful habits, you can maintain healthy teeth without risking permanent damage. Number 8. Drinking lemon juice with sugar when calcium levels are low. Lemon juice with sugar is a common combination that many people enjoy, believing it to be a healthy choice. The mix of vitamin C from the lemon and the sweetness of sugar seems harmless on a hot day. However, regularly consuming lemon juice with sugar, especially when calcium levels are low, can lead to serious health consequences that often go unnoticed. The obvious risk is sugar's detrimental effects. The CDC warns that excessive sugar intake is linked to obesity, type 2 diabetes, and heart disease. While lemon juice is low in calories, adding sugar significantly increases caloric content, contributing to weight gain and metabolic syndrome, which raises the risk of heart attacks and strokes. Nearly 40% of American adults are overweight or obese, largely due to high sugar consumption. Beyond sugar, the citric acid in lemon juice can leach calcium from bones. Research from Harvard's T.H. Chan School of Public Health indicates that acid from citrus fruits can deplete calcium, particularly in those already deficient in the mineral. This can lead to osteoporosis, making bones weak and fragile. The dual threat of sugar and citric acid increases inflammation, further compromising bone strength. Lisa Martinez, a 52-year-old from Mexico, illustrates the seriousness of this issue. Always mindful of her figure, she regularly consumed lemon water with sugar, believing it supported her health and digestion. She was unaware of her low calcium intake due to her limited dairy consumption. After a few years, Lisa began to experience severe back and joint pain, which escalated with physical activity. Doctors diagnosed her with osteoporosis caused by years of calcium deficiency and exposure to citric acid. A minor fall led to a hip fracture requiring major surgery. To avoid similar problems, limit sugar in lemon juice. Opt for alternatives like honey or natural sweeteners with a low glycemic index, such as stevia, to mitigate risks associated with metabolic syndrome and obesity. Individuals prone to calcium deficiency should be particularly cautious with acidic foods. The National Institutes of Health recommends regularly checking calcium levels and taking supplements as needed. Including calcium-rich foods like broccoli, almonds, and dairy in your diet can help counteract the effects of acidic foods. It's also vital to rinse your mouth with water after consuming lemon juice to neutralize acidity, protecting both your tooth enamel and bone health. Number 7. Using lemon juice in marinades for grilled meats. Who doesn't enjoy juicy, flavorful grilled meat? Marinating it in lemon juice can enhance flavor and tenderness while providing a vitamin C boost. However, this culinary approach carries hidden dangers that every barbecue lover should recognize. When lemon juice is used to marinate meat, and then that meat is cooked at high temperatures on the grill, a chemical reaction occurs that can seriously affect your health. At elevated temperatures, the proteins and fats in the meat react with the acid in lemon juice, creating harmful compounds like heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, HAs, some of the most dangerous carcinogens linked to stomach, colon, pancreatic, and even breast cancers. The American Cancer Society has conducted extensive research showing that cooking meat over an open flame or at high temperatures significantly increases the production of HCAs and PAs. This risk escalates when juices from marinated meat drip onto the coals or grill, producing carcinogen-laden smoke that reabsorbs into the meat. Regular consumption of such grilled meat has been shown to increase cancer risk by 30 to 40%. The FDA also warns that acidic marinades like lemon juice amplify the formation of these carcinogenic compounds, turning your favorite dish into a ticking health time bomb. Carlos Rodriguez, a 40-something barbecue enthusiast from Brazil, marinated meat with lemon juice, spices, and oil, believing it to be a healthy option. Over time, he experienced persistent stomach pain and discomfort, ultimately receiving a diagnosis of stomach cancer, a condition that developed from years of consuming grilled meats marinated in lemon juice. Carlos underwent long, difficult treatments and was forced to change his eating habits to mitigate health risks. To avoid these outcomes, follow a few essential guidelines. First, reduce cooking time at high temperatures. Instead of grilling for long periods, consider braising or baking at lower temperatures to minimize harmful compound formation. Second, steer clear of using lemon juice for meat marinades when grilling. Instead, opt for herb and spice marinades that enhance flavor while lowering health risks. Studies indicate that herbs like rosemary, garlic, and thyme can decrease the production of carcinogens during grilling. Lastly, monitor your cooking process to prevent juices and fat from dripping onto the flames. Use foil or specialized grilling equipment to lessen harmful substance creation. By following these straightforward tips, you can savor delicious grilled meat while protecting your health. Number 6. Excessive use of lemon juice with hypertension and in savory dishes. Lemon juice is a popular ingredient in salad dressings and marinades, adding a refreshing flavor to many dishes. Despite its health benefits, like high vitamin C and antioxidant content, excessive consumption of lemon juice can pose significant risks for individuals with hypertension, especially when combined with salty foods. The citric acid in lemon juice can trigger gastric juice production and fluid retention. The most dangerous mix is lemon juice with high sodium foods. The CDC warns that excessive sodium intake can contribute to high blood pressure, and when combined with acid from lemon juice, the risk of hypertensive crisis rises sharply. Hypertension can lead to severe cardiovascular issues, including heart attacks and strokes. A study published in the Journal of Hypertension indicates that combining acidic foods with high sodium can increase blood pressure spikes. For instance, Jennifer Lee, a 45-year-old with a family history of hypertension, often added lemon juice to her salads loaded with salty feta cheese and olives. Over time, her blood pressure readings surged, leading to a hospitalization for a hypertensive crisis. Doctors advised her to limit both sodium and acidic foods to manage her condition better. To mitigate this risk, be mindful of your lemon juice intake and its interaction with salty foods. Limit your consumption of lemon juice, particularly if you have hypertension. If you enjoy lemon-flavored dishes, consider using fresh herbs or spices to enhance flavor without the added sodium. Keeping an eye on your overall salt consumption is crucial for managing blood pressure and reducing the risk of cardiovascular problems. If you're uncertain about your sodium intake, consult a healthcare professional for personalized advice. Additionally, lemon juice offers health benefits, but it's crucial to monitor your blood pressure regularly and adhere to your doctor's dietary guidelines. Hypertension is a condition that requires close attention, and avoiding harmful combinations, such as salt and lemon juice, can help prevent serious health issues. 5. Using lemon juice for kidney health and detox programs. Many individuals consider lemon juice essential for cleansing the body and aiding weight loss. It's often added to detox drinks and programs with the belief that its acidity helps eliminate toxins and supports organ function. However, this perceived benefit conceals a significant risk, especially for those with existing kidney issues or those who misuse detox programs. Lemon juice is high in oxalates, which can adversely affect kidney health when consumed in excess. The National Institutes of Health, NIH, warns that a diet high in oxalates can lead to the formation of oxalate kidney stones, as these compounds bind to calcium in the urine, creating hard crystals that may develop into stones over time. This poses a serious threat to individuals predisposed to urolithiasis or suffering from kidney disorders. Furthermore, popular detox programs often involve excessive lemon juice intake. The Centers for Disease Control and Prevention, CDC, caution that prolonged detox regimens can result in electrolyte imbalances and dehydration, putting additional strain on the kidneys. Fluid and electrolyte deficits can hinder blood filtration, potentially leading to kidney failure. Research from the Harvard T.H. Chan School of Public Health indicates that frequent consumption of lemon juice in detox diets is linked to an increased risk of chronic kidney disease. If oxalates are not adequately excreted, they can accumulate in the kidneys, exacerbating conditions and causing inflammation and pain. A case in point is Jean-Pierre Bourre from France, who turned to detox diets focused on lemon juice to enhance his health. He consumed several glasses of lemon water daily, believing it would cleanse his system and aid digestion. However, after a few months, he experienced sharp pains in his kidney area. Upon hospitalization, he was diagnosed with large oxalate kidney stones requiring surgery. Doctors attributed his condition to his regular lemon juice consumption, which is high in oxalates. To avoid such issues, it's essential to consume lemon juice cautiously, particularly if you are susceptible to kidney disease. If you have kidney stones or other urogenital disorders, the National Institute on Aging, NIA, advises against excessive intake of citric acid and oxalate-rich foods to prevent oxalate buildup in the body. Additionally, it's wise to avoid prolonged and excessive detox programs. Instead, focus on a balanced diet and adequate hydration to support kidney health naturally. If you choose to include lemon juice in your diet, monitor your intake and adhere to recommended amounts. Consulting a healthcare provider or nutritionist can ensure that such additions are safe for your health. By avoiding excessive lemon juice, especially in detox regimes, you can maintain kidney health and protect against severe consequences like kidney stones and kidney failure. 4. Misuse of lemon juice for cosmetic and skin treatments. Lemon juice has long been hailed as a natural remedy for skin brightening, age spot removal, and acne treatment. Many people apply it directly to their faces, convinced that its acidity will quickly resolve their skin issues. However, using lemon juice for cosmetic purposes can not only fall short of expectations, but may also pose serious risks to skin health, particularly when misapplied. With a pH level between 2.2 and 2.5, lemon juice is highly acidic and can be aggressive on the skin. When applied undiluted, it can lead to severe irritation, chemical burns, and even heightened sensitivity to sunlight, a condition known as phytophotodermatitis, where skin becomes inflamed and discolored when exposed to UV rays. The CDC has noted that this reaction often occurs in individuals who use citrus products in home beauty treatments and then go out into direct sunlight. Research from the Harvard T.H. Chan School of Public Health reveals that citric acid can compromise the skin's protective lipid barrier, making it susceptible to bacteria and pollutants, which can lead to acne, inflammation, and even serious infections like cellulitis. Additionally, the Food and Drug Administration, FDA, warns that the improper use of acidic products like lemon juice can result in chronic skin conditions, including dermatitis and eczema, particularly for those with sensitive skin or pre-existing skin conditions. Take the case of Ana Gonzalez, a 29-year-old from Mexico who wanted to lighten dark spots on her skin. Following an online recommendation, she used lemon juice nightly, believing its acidity would eliminate pigmentation. After a few treatments, Anna went to the beach without sunscreen, unaware that citric acid had rendered her skin extremely sensitive to UV light. Consequently, she developed severe phytophotodermatitis, resulting in burns, swelling, and hyperpigmentation that required months of treatment. To prevent serious skin damage, remember that lemon juice should not be applied directly to the skin, especially undiluted. The NIA recommends using professional skincare products formulated specifically for skincare, where acidity levels are properly balanced. If you wish to incorporate natural products into your routine, opt for milder acids like lactic acid or almond acid, which are gentler on the skin. It's also crucial to apply sunscreen after any acid treatments to shield your skin from harmful UV rays. Moreover, the World Health Organization, WHO, emphasizes that regular moisturizing and balanced skincare are vital for maintaining healthy, youthful skin. Rather than experimenting aggressively with lemon juice, focus on moisturizing, protecting, and maintaining a healthy skin barrier to avoid unwanted effects. By steering clear of lemon juice in skincare and selecting appropriate beauty products, you can keep your skin healthy and prevent severe burns and irritations. 3. Adding lemon juice to hot drinks and gastroesophageal reflux. For many, starting the day without a cup of hot tea infused with lemon juice seems unthinkable. This familiar blend, often associated with freshness and health benefits, can pose risks, particularly for individuals with gastroesophageal reflux disease, GERD, or those prone to stomach and esophageal issues. The high acidity of lemon juice, with a pH level around 2.2 to 2.5, can drastically increase the acidity of already harsh stomach contents when added to hot beverages. This poses significant danger for those with GERD, a condition characterized by stomach acid frequently entering the esophagus, leading to heartburn and inflammation. The NIH warns that lemon juice in hot tea or water can boost acid production in the stomach, worsening reflux symptoms and heightening the risk of esophageal erosions and ulcers. The CDC reports that GERD affects about 20% of adults globally, and poor dietary habits or the consumption of acidic drinks, like tea with lemon, can exacerbate the condition. Hot drinks containing lemon juice can weaken the lower esophageal sphincter, the muscle that prevents stomach acid from flowing into the esophagus, allowing acid and lemon juice to irritate the esophagus and damage its lining. Furthermore, regular consumption of hot lemon-infused drinks can contribute to the development of peptic ulcers, as citric acid can be harsh on the stomach walls, especially when consumed on an empty stomach or during high acidity levels. Studies from Harvard D.H. Chan School of Public Health have shown that acid in hot beverages can significantly speed up the erosion of the esophageal and gastric mucosa, leading to ulcers and damage. Maria Santos, a 46-year-old from Spain, began her day with hot tea heavily flavored with lemon juice, believing it bolstered her immune system and detoxified her body. Over time, she started to experience persistent chest pain and severe heartburn, which worsened daily until she was diagnosed with GERD. Doctors explained that her symptoms were due to the constant contact of stomach acid and lemon juice with her esophagus, resulting in inflammation and erosion. To prevent such issues, exercise caution when adding lemon juice to hot beverages, especially if you have a tendency toward reflux or other esophageal disorders. The FDA recommends limiting acidic foods and drinks for those with GERD. If you enjoy lemon in tea or hot water, do so sparingly and avoid consuming these beverages on an empty stomach. Instead, consider herbal teas like chamomile or ginger, which are gentle on the digestive system and provide a soothing effect. The WHO highlights the importance of maintaining a healthy diet and avoiding excessive intake of acidic foods to safeguard esophageal and stomach health. If you experience symptoms of GERD or other gastrointestinal conditions, consult a gastroenterologist for expert guidance. Adjusting your diet, avoiding lemon juice in hot drinks, and seeking appropriate treatment can help you maintain a healthy esophagus and stomach for years. 2. Combining lemon juice with alcohol and chronic liver disease. Lemon juice is a popular addition to alcoholic beverages, with cocktails like margaritas and gin and tonics often featuring its refreshing flavor. However, few consider the potential dangers of this combination, particularly for individuals with chronic liver disease. Lemon juice, as a potent acid, increases the liver's toxic load when consumed alongside alcohol. Since the liver is responsible for breaking down and eliminating alcohol from the body, adding citric acid forces it to operate at maximum capacity, which can be especially hazardous for those with chronic liver issues, such as cirrhosis, fatty liver disease, or hepatitis. The NIH emphasizes that the liver acts as the body's primary filter, and its ability to process toxins diminishes with regular alcohol consumption. When combined with lemon juice, this effect is exacerbated, leading to irritation of the bile ducts and compromised liver function, potentially resulting in acute liver failure and severe liver damage, including cell necrosis. Studies from the CDC indicate that consuming alcohol with acidic foods heightens the risk of liver inflammation, worsening conditions like cirrhosis and alcoholic hepatitis. Additionally, regular intake of alcoholic beverages mixed with acidic ingredients, such as lemon juice, can accelerate the progression of chronic diseases and lead to complete liver failure. Consider the story of James McAllister, a 37-year-old man from the United States. After a stressful year, he developed a habit of mixing his cocktails with extra lemon juice, believing it would aid in detoxifying his system. Unbeknownst to him, the acidity placed an immense burden on his liver. After months of excessive drinking, he began to experience fatigue, jaundice, and abdominal pain. Upon visiting the hospital, he received a diagnosis of acute liver failure attributed to a combination of chronic alcohol use and increased citric acid consumption. To mitigate these risks, individuals with liver disease or concerns about liver health should exercise extreme caution when consuming lemon juice with alcohol. The American Liver Foundation advises avoiding acidic mixers in alcoholic drinks to minimize strain on the liver. Limiting or eliminating alcohol altogether is often the safest route for maintaining liver health. Moreover, if you are concerned about liver health, consider consulting a healthcare professional or nutritionist for personalized dietary advice. Making informed choices about alcohol and acid consumption can significantly reduce the risks associated with liver disease, ensuring long-term well-being. 1. Excessive lemon juice consumption and osteoporosis. While lemon juice is often marketed as a health booster, its excessive consumption can lead to serious health risks, particularly for those at risk of osteoporosis. The acidity of lemon juice, particularly its citric acid content, can contribute to bone health deterioration when consumed in large amounts. Research shows that excessive acid intake can lead to decreased calcium levels in the body. Calcium is crucial for maintaining bone density and preventing osteoporosis, a condition characterized by fragile and weak bones, making them more susceptible to fractures and breaks. Studies from the NIH indicate that excessive citric acid consumption can increase urinary calcium excretion, leading to potential deficiencies that weaken bones over time. The CDC highlights that osteoporosis affects millions of individuals worldwide, with women being particularly vulnerable, especially post-menopause. Diets high in acid can disrupt calcium absorption, leading to significant bone health issues over time. Additionally, studies have linked high levels of citric acid to an increased risk of fractures in older adults. For instance, Clara Thompson, a 65-year-old woman from Canada, regularly consumed lemon juice in her water, believing it helped with weight loss and digestion. However, after a few years, she began experiencing joint pain and frequent fractures. Upon consultation, her doctor discovered that her high intake of lemon juice led to calcium depletion, significantly affecting her bone density. To avoid such consequences, moderation is key when consuming lemon juice. The NIH recommends balancing acidic foods with calcium-rich sources such as dairy products, leafy greens, and nuts. Ensuring adequate calcium intake is essential for bone health, particularly for those at risk of osteoporosis. If you're concerned about osteoporosis or bone density, consult a healthcare professional or nutritionist to determine safe limits for lemon juice consumption. By making informed dietary choices, you can protect your bone health while still enjoying the benefits of lemon juice in moderation.